Welcome to Health and Veritas. I'm Harlan Krumholtz.
And I'm Howie Foreman. We're physicians and professors at Yale University. We're trying to get closer to the truth about health and healthcare. As we've talked about before, 51% of Medicare enrollees are now receiving Medicare through Medicare Advantage plans. Those are private Medicare plans. Aetna, Cigna, Aetna CVS, Cigna, United Health Group, Elevance. So in general, they're paying less than they would pay for Medicare. Now remember, Medicare is expensive. About a third of employers still provide a retiree health benefit. If you don't have that, you actually have to buy a Medigap policy just to make standard Medicare affordable for you. If you're very poor, you'll get Medicaid combined with Medicare. And then there are the near poor, people who don't qualify for Medicaid, for whom Medicare can be really expensive.
So we shouldn't be really calling Medicare universal coverage. It's not universal coverage. Of course, every time I see United Healthcare come out, I mean, it's some gazillion amount of money that they've made in profits. Meanwhile, hospitals, everyone else is getting squeezed. How is it that this system is configured that these large companies are just making so much money?
So Medicare Advantage, when the newest configuration came in, it was intended to create a profitable opportunity. That was 2003.
A big profitable opportunity. So this week, the CDC came out with something about burnout, that healthcare workers saw an increase in poor mental health during the past 30 days from about 3 to almost 5 days a month. The percentage of health workers who intended to look for a new job increased to 44%. We're nudging up to 50% of turnover, and a lot of people are just leaving the field.
We're seeing a very similar elevation in suicide rates among healthcare workers.
Now, you work in the emergency department. You do your shifts there, so this must be something that you're observing as well.
Yeah, look, we not infrequently will have somebody sent over for an X-ray after they've been pummeled by a patient.
One of our healthcare workers.
Yes. Yeah,
really.
Generally nurses.
And, in this thing, the person who wrote this op-ed said, I don't know anyone who works in the emergency department who hasn't suffered some form of violence there.
I believe that. Yep. I got very inspired about a paper that I saw in radiology. And a AI software product reduces the miss rate of what we call subsegmental pulmonary emboli by 59%.
What's a subsegmental pulmonary emboli?
So pulmonary emboli, which can be an acute cause of death.
So it's a highly consequential diagnosis.
Right. So we have software now that helps us see those. I miss them periodically, and with our AI program, it will show them to me, and then I go back and I look at it and I'm like, yep, it's there.
You've been listening to Health and Veritas with Harlan Krumholtz and Howie Foreman.